99 Days of Dental Care, Dr. Suresh R. This is day 7. How many types of dental crown are there? For those who are hearing about the dental crown for the first time, the sheer variety of crowns available might cause confusion on which is the best type of crown for them. So let us see about the various types of dental crowns. The dental crowns can be classified as short-term or temporary crowns and long-term crowns based upon their duration of intended usage. The most commonly used short-term crowns are the acrylic crowns, which is basically a type of plastic material. Composite crowns are the other type of short-term crowns, which is more natural looking and stronger than the acrylic crown. These short-term crowns are used only for a limited period of time till the long-term crowns are fabricated and fixed. They usually last for about 1 week to 1 month depending upon their strength. Among the long-term crowns, the first type is the full metal crown. The full metal crown can be fabricated using the traditional casting process known as the cast crown, or it can be fabricated using the CAD-CAM technology, which is called as a DMLS crown. The word DMLS stands for direct metal laser sintering. The difference between these two is that the crown which is fabricated using the CAD-CAM technology, that is the DMLS crowns, they are more accurate in terms of fit, shape and adaptation. The next type of long-term crown is called as a metal ceramic crown or the porcelain fused to metal crown, or commonly it is called as a PFM. In this type of crown, the inner layer is made up of metal and the outer layer is made up of porcelain, which is a type of ceramic material. Again, the PFM crowns are classified into two types based upon the method of fabrication of the innermost metal layer. So we have PFM crown cast type and the PFM crown DMLS type, in which the DMLS type have a better fit and adaptation. These PFM DMLS crowns can be further classified into two types based upon the type of metal used for the innermost metal layer. The regular PFM DMLS crowns, which is used for a long time, are made up of the nickel chromium alloy, and now we have the latest ones which is made up of titanium alloys. The advantage of titanium alloy is that it is lighter in weight, more friendly to the gums and more natural looking. So this is especially advantageous when fabricating a large number of crowns for a single patient, such as the full mouth rehabilitation, or when fabricating a crown over a dental implant, which is also made up of titanium alloy. So in the case of dental implants, we have the crown is also made up of titanium, which is of the same material as a dental implant. So we have a highly compatible material. The last type of long-term crown is a metal-free crowns. They are of two types: the all ceramic crown, which is made up of lithium disilicate, and zirconia, which is made up of zirconium oxide. They can be either made up of a single layer of material called as a monolithic crowns, or made up of multiple layers of material, in which they are called as a multi-layered crowns. So the difference between the monolithic and multi-layered crowns is that the multi-layered crowns are more natural looking. The advantages of these all ceramic or zirconia crowns is that they look very natural, they are friendly to the gums, and they do not cause any interferences in the CT scan and MRI images of the head in case the patient needs it in the future. The all ceramic material is suitable for crowns on the front teeth where there is not that much of load of chewing forces on the teeth, and also for indirect restoration such as veneers, inlays and onlays. The zirconia crowns are more suitable for back teeth, although they can be used for the front teeth. But as a default, we always prefer all ceramic crowns for the front teeth and zirconia crowns for the back teeth for the obvious reasons of higher strength of the zirconia crowns and more natural looking all ceramic crowns. So the order of crowns in the terms of increasing cost are the acrylic crown, which is lesser in cost when compared to the composite crown, which is again lesser in cost when compared to the metal crown. Among the metal crown, the DMLS crown is more costlier than the cast crown. The metal crown is of lesser cost than the PFM crowns, and among the PFM crowns, the DMLS crown is more costlier than the cast crowns, and among the DMLS crowns, the DMLS titanium crown is more costlier than the DMLS nickel chromium crowns. And all these PFM crowns, they are of a much lesser cost than the zirconia crowns. The zirconia monolithic crowns is less costlier than the all ceramic, and all ceramic is less costlier than the zirconia multi-layered crowns. In terms of aesthetics, the order of the most natural looking crowns are the all ceramic, which is more natural looking than the zirconia, which is multi-layered, which is more natural looking than the PFM DMLS titanium, which is more natural looking than the PFM DMLS nickel chromium, which is more natural looking than the PFM cast crown, which is much better than composite, which is much better than acrylic, and which is much better than zirconia, which is monolithic. In terms of tissue friendliness, the order of the most biocompatible crowns are zirconia and all ceramic. They are almost equal, and this is better than the PFM DMLS titanium, which is better than PFM DMLS nickel chromium, which is better than PFM cast metal, which is better than composite, and composite is better than acrylic in the terms of tissue friendliness. Apart from this, there are a few newer materials available for dental crown fabrication, such as PEEK and graphene, about which I will be discussing them separately. Thank you for listening. Keep smiling. Hashtag 99 Days of Dental Care, Dr. Suresh R. Please follow us on Facebook, Instagram, YouTube, Twitter, Blogspot, and Spotify. Please subscribe to this channel, Dhanvantri Dental Care and Implant Center. Please like this video and share it with your friends and family. And please subscribe to this channel. Thank you.